Morning po again to everyone and to our LG partners and of course kay Ma'am Telma and kay Asik po and kay Yusek. Good morning po to everyone. Now, again, I'm Arianne Zamora po. I'm the lead for the data analytics for the COVID-19 surveillance and quick action unit at the Department of Health. And on behalf po of Yusek Vergere and Director De Guzman, I would like to present the national situationer. By the way po, we're presenting the national situationer with the aim po of for everyone to also appreciate ano po yung impact ng contact tracing natin and why we're doing the contact tracing in the general sense, how it affects our numbers. So to start with, here are the numbers that we have so far as of yesterday. So currently we have 1,143,963 cases for COVID-19 and 4.8% po dito ang active cases. Now also, we have 93.52% ng mga kaso na to ang recoveries and meron pong 1.68% dito ang namatay po. Also, looking at our epidemic curve, katulad po ng na-share kanina ni Ma'am Heidi sa screen kanina, this epidemic curve po plots yung mga kaso po natin mula sa simula po ng pandemya. At makikita po natin dito, yung atin pong kaso ay nag-peak noong pong first week ulit ng Abril after po ng ating highs noong nakaraang taon. So makita po natin itong pong bar na may sa pinakataas, ito po yung first week ng April. Also, nakakakita din po tayo naman ng pagbaba ng kaso nitong mga nakaraang linggo. Ngayon po, also yung atin pong numero, kung alin po or saan ang gagaling yung mataas na kaso ng COVID-19, noon pong nag-peak tayo, ang kaso po 48% almost po ito pong blue bar ay galing po sa NCR. Meron din po tayong mga contribution from Region 4A and then ito pong black bar naman po is from other regions as well. So as we go along po in the recent weeks, makikita po natin na from 48% of the cases of the national numbers, bumaba na po ang contribution ng NCR to 31%. Kasama din po yung Region 3 and 4A. Samantalang tumataas or hindi po masyadong nagbabago or lumaki po yung contribution na binibigay ng other regions natin. So it's something to watch out for sa atin pong mga numero. Alright? So also, tingnan din po natin ang atin naman pong testing data. If we look at our testing data, nakakita po tayo ng decrease of 4.9% ng ating daily test sa recent 7 days compared po sa previous 7 days natin. No? Now, ang ating pong positivity rate ay nag-improve sa 13.1% in the recent 7 days compared po sa 15% nung nakaraang 7 araw. However po, yung atin pong pagbaba ng lab output ay kailangan pong imbestigahan dahil sa estate or ito po ay reflection ng tunay na pagbaba ng kaso. So, yun po, pagka nagpre-report po kami ng pagbaba ng kaso, we're very cautious in saying na it's a good indication, pero at the same time, kailangan po nating i-check kung ito po ba ay tunay na pagbaba talaga ng kaso. Moving naman po sa ating numero in terms of death, napakahalaga naman po. Usually, it mirrors the numbers that we have for cases. So makita po natin kanina, no, may pagtaas, biglang pagbaba, at ito na naman po ulit, tumaas po yung ating number of deaths nitong March and April. Now, for the deaths, last week of April has gone down and almost ka-level na po niya yung August 2020 figure natin na 77 deaths per day. So, nakakita po tayo ng improvement sa ating number kasi po kung makikita po natin, katulad po ng ating epidemic curve, nagkaroon po tayo ng mas mataas na mga reported deaths noong unang mga linggo ng Abril. Right. So, ano po naman ba yung ating numbers na related din sa PDITR, sa ating pong pag-detect at pag-isolate ng kaso, including contact tracing? So, this is an information or bar graph na ginawa po namin para po matrack natin yung pong sige, isa-isayin po natin ha. So, mula po sa time na magkaroon po ng onset yung isang kaso, hanggang sa time po na magpa-test siya, makuha po niya yung result at ma-confirm po yung result. On average, sa national numbers po, actually national capital region po, no, ang average po is 12 days from onset to reporting ng isolation. From time na nagkaroon po ng onset yung kaso hanggang sa mag-isolate po siya, it's 12 days. Bakit po namin ito ipinapakita? Napakahalaga po ng numero na ito. Ayon po sa isang projection na ginawa ng caster team, kapag po napababa natin ang bilang mula sa onset, papunta po sa isolation, bababa din po yung nakikitang projected number ng kaso natin. So hindi lang po siya something na nagdadala ng pag-lockdown or mga general community quarantine classification. If tayo po ay mapapababa natin yung bilang mula sa pagkakaroon ng onset hanggang sa ma-isolate po yung kaso, malaking bagay po iyon sa atin pong buong COVID-19 response. So ito po sana ang target natin, 5 days. Kaya lang po, makita po natin na mataas pa rin yung bilang. So mamaya po sa mga PDITR strategies, tingnan po natin ano po ba yung ways kung paraan para po mas mapababa yung numbers natin. And kung iisipin po natin, no, malaki pong ambag ng contact tracing dito po sa ating numero. Kasi po, kung atin pong na-contact trace yung mga kaso or mga close contacts ng isang index case, definitely mas mapapabilis po yung pagtetest sa kanila at yun din pong pag-isolate. Now, going over naman po sa ating information na nakuha about mobility. Yung mobility po na nakukuha nating data is galing po ito sa Google, kung saan tinatrack po nila yung mobility ng tao, kung mas lumalabas pa tayo or hindi across time. So, dito po sa graph na to, nakita po natin na yung atin pong mobility sa all settings, so that's grocery, pagpunta sa grocery, parks, workplaces, retails, and transit, has increased in the first weeks of May. And kung mapapansin nyo po itong dip na to, ito po ay numbers nung April 4, kung saan nagkaroon po tayo ng ECQ sa Metro Manila at least. So, makita po na nagkaroon ng pagbaba. However, tumataas po siya. So ang kahalagahan po nito is that hindi lang po ito, hindi po nag-iisang sagot ang pag-lockdown or pagkakaroon natin ng mas mahigpit na restriction sa pag-control ng mobility. So dadami pa rin po yan habang nagbubukas tayo ng economy. And at the same time, mas lalo pong nagiging mahalaga yung role ng ating mga contact tracer at ang ating buong contact tracing efforts. Alright, so doon naman po tayo ngayon mag-focus sa atin pong COVID-19 response strategy. So sabi po nila, no, ito daw po yung cornerstone ng ating COVID-19 response at ito po yung mga general principles, daanan lang din po natin this morning. So yung PDITR, so we have prevent, detect, isolate, treat, and reintegrate. So ano po ba yung mga principles involved in the PDITR response? So unang-una po is the strict observation of the implementation of the minimum public health standards. Ito po yung physical distancing, hand hygiene, cough etiquette, and wearing of mask among others. Also, isa pa pong general principle natin is deciding on the appropriate course of action for isolation, quarantine, and testing. And it shall be based on proper clinical assessment anchored on 2 factors. So titingnan po natin lagi yung symptom and exposure. Again, 2 important concepts sa contact tracing. The pathway shall reflect the most cost-effective intervention following the pre-test probability framework. Also, pangatlo pong principle natin is the facility-based quarantine and isolation if the conditions naman po will allow. Also, here po we have general principle number 4 wherein all close contact po, probable and confirmed cases shall be placed under quarantine and must finish quarantine. Napakahalaga po nito. While suspect, probable, and confirmed cases shall be placed under isolation naman po, regardless of the results of their test. Now also, for the principle number 5 naman po, use the right test for the right reason. So hindi po tayo yung nagpa-promote ng indiscriminate testing. Gusto po natin talagang matest kung sino po ang dapat nating binibigyan ng test or pinapa-RT-PCR, given na din po na alam naman natin na limited po ang ating ding resources. So tinitingnan natin kung ano po yung availability ng test, best time to use the test, turnaround time ng ating test results, and specificity and sensitivity ng test natin na independently validated. And then lastly, is understanding the use and limitation of available testing technologies, as mentioned din po kanina. So, alam naman po natin no, na ang ating gold standard pa rin is yung RT-PCR. Pero syempre po, aware of the limitations at ating mga kakulangan sa resources, we also do consider antigen test with certain conditions po and guidelines. Alright. Now, going over the, ano naman po muna, pathway. Although ito po ay madidiscuss din, I believe, sa ating contact tracing discussion later with our partners sa WHO. Here we are looking at the viral pathway. Medyo ma-science lang po yung konti, complicated yung itsura ng graph. Pero ang sinasabi lang po nito is generally, ang tao pong na-expose sa COVID has around 2 days prior to the onset of symptoms para po pag parang magtanim yung virus sa kanyang katawan, and then hindi po agad yan usually nagmamanifest or nagpapakita ng sintomas kung magiging symptomatic siya. So a person can develop the disease around 2 to 14 days after exposure. Kaya napakahalaga po na atin pong sinusunod yung quarantine and isolation protocol given what we know about COVID-19. And also immediate quarantine of close contact is necessary even when asymptomatics po sila as infectious period begins 2 days prior to symptom onset. So napakalaga po na ating trabaho sa contact tracing talaga when we find them. Now, also, testing po din po ideally should be around 5 to 7 days after exposure. Ito po naman ayon sa pag-aaral, meron po talagang nami-miss ang ating test. So, ang peak time po ng pagtetest natin is 5 to 7 days kasi yun daw po yung may pinakamataas din na viral load na makikita sa katawan ng tao. Kaya din po yun yung ating suggested. Now, isa pong meron po tayong diagram dito no kung paano po nagwo-work yung usual na patient flow. So example po natin dito is si Marco po na-expose siya sa COVID-19 nung day 0. Ngayon po nagpa-test siya ng day 5. Actually day 5 pa nga siya nagpa-test and the result was negative. So hindi pa po nakita dun sa test. Kaya lang po nung day 8 pumasok po si Marco at nagtrabaho po siya at nagpatuloy sa normal activities niya. Kaya lang po, he was contagious already on day 8 and 9. So before symptoms po, no? Before pa po siya nagpakita ng symptoms, which was on day 10. So dito po sa diagram na ito, actually ito po ay probably sabihin natin anecdotal, pero marami po actually nangyayaring ganito and it's one of the risks na meron sa COVID. Kaya mahalaga po yung atin nga pong quarantine and isolation protocol must be followed strictly. Not just for symptomatics and confirmed cases, but also for the close contacts. Also, given po the viral pathway of COVID-19, so isolation and quarantine po serves as our main intervention to prevent the spread of the disease. Kasi po once ma-contain po natin yan, hindi po mag-spread further ang COVID-19. So, just a recap po, no, quarantine is intended po for persons who are not sick. Wala po siyang sakit, pero siya po ay exposed. Tapos po, when they're separated from people in advance, ito po naman is just in case po na sila po ay maging may sakit or infectious. On the other hand, isolation naman po is intended for people who are already sick. May mga sintomas na po, ubo, sipon. And those po na identified already as suspect, probable, and confirmed cases. Yun po. So yun po yung tinatawag nating isolation. And for this naman po, yung duration naman lang, ang quarantine is again 14 days. Pag isolation po is 10 days para sa mga asymptomatic, at least 3 days po silang asymptomatic. So kahit po 10 days na po sila, kung meron pa po silang lagnat, ubo, sipon, on the 10th day, hindi pa po matatapos ang isolation kasi kailangan pong ma-satisfy din nila itong at least 3 days of being asymptomatic. Alright? Now, also, ano po ba ang implication of differentiating as isolation and quarantine? So 3 points. First, it is required that these facilities po meron po silang requirement in terms of healthcare workers. So for isolation facilities, it's intended to treat and monitor suspects, probable and confirmed cases. So for quarantine facilities naman po, it's intended to house individuals under observation pa lamang that will develop signs and symptoms of COVID-19. So for isolation facilities, considered as a medical facility po siya, and will be subjected under the CHD certification process. Meanwhile, ang quarantine facilities po may opt not to have a medical personnel. Also, meron din po siyang implication sa PhilHealth reimbursement sa isolation facility shall be covered by the CIU package. Now, regarding testing naman po, why do we test? So we have three reasons for testing. First po is to diagnose confirmed cases and to deploy proper clinical management and initiate contact tracing. So pagka yun pong, so ang testing po natin for diagnosis, tinitingnan po kung may COVID-19 ng isang tao, and then yung contact diagnostic test ay sinasagawa kung may sintomas or known history of exposure. Also, for testing for screening naman po, ang objective niya or layo niya is ma-identify yung mga infected individuals bago pa po man sila mag-develop ng kanilang symptoms at yung mga infected na walang signs and symptoms na nakakahawa. So gusto po natin kasing makat ang transmission ng COVID-19 bago pa sila mag-manifest ng symptoms nila. At ang symptom screening po, kasama po dito yung symptom screening for return to work. And lastly, we have testing po for surveillance na ginagamit upang magkaroon po tayo ng impormasyon sa prevalence ng COVID-19 sa isang population. So sa surveillance testing, ito po ay maaaring gawin randomly sa certain percentage po ng population upang ma-monitor po kung may pagtaas or pagbaba ng prevalence sa population at kung makakita po ng epekto sa community quarantine at minimum public health standard. Isa pong mga siguro example nito yung nagkakaroon po tayo paminsan-minsan ng aggressive community testing sa ibang area. Pag nakita po ng mga ating LCEs or even ng local health officials din natin na meron pong mga spikes in cases. Yeah. So just recap, ang reasons po natin is to diagnose for close contacts, prioritizing asymptomatics. We want to screen those high level of risk exposure. Example po pala nito, no, yung when we do border control measures, so higher levels of risk, kunyari po galing sila sa lugar na may mataas na kaso ng COVID-19, na-expose sila sa aeroplano, so we want to screen them as well. That's why we test. And then lastly is for surveillance, random sampling of a certain percentage of a specific population. Now, going over to the diagnosis naman po, this is the case management for close contact, suspect, and probable and confirmed cases. Okay. So ito po ay isang table or graph na I think marami na din po sa atin ang nakakita. Ito po yung contact tracing tree ng first, second generation, and general close contacts. So just like other strategies po, contact tracing is important in containing outbreaks of infectious disease. Now again, na-mention po kanina po ni Asik Manuel, it refers to the identification, listing, assessment, and monitoring of persons who may have come into close contact with a confirmed case. Now this illustration po shows how we identify ourselves upon possible exposure to confirmed cases. So ito pong naka-red, siya po ay si person A. Sa po siyang confirmed case, nag-positive po sa RT-PCR. Now, ito pong si person B is considered a first generation close contact because he or she may have had the following exposures 2 days before and 14 days after the onset of symptoms for person A. So, una po, pwede pong nagkaroon po siya ng face-to-face contact with this confirmed case within 1 meter for at least 15 minutes. Or nagkaroon po siya ng direct physical contact with a probable and confirmed case. Ito nga pa rin po si sir na confirmed case, direct care for a patient with probable or confirmed COVID-19 disease without using recommended PPEs and other situations as indicated by local risk assessments. Now, for close contact, they can be classified further into second or third generation. So, si person C naman po ay close contact ni second generation close contact ni person A or close contact of a first generation close contact. So, ito po siya. And then si D naman po, so follows, na ito naman po ay direct close contact ni person, sabihin natin C, pero po medyo malayo na po siya sa confirmed case. And also, we have person E, kunyari po dito, someone who may have been exposed to a confirmed case, such as those na nag-attend po sa same event, social gathering, or venue with the confirmed case. Pero hindi po niya na-fulfill yung mga na-mention natin kanina na 15-minute interaction na less than 1 meter, Yun po, without PPE and such. Okay. Alright, so also for the contact tracing tree, ayun na po, medyo na-discuss na din natin kanina, no? Pero ang intervention natin is first, for the second generation and third generation close contact is to self-monitor and strictly adhere to the minimum public health standards. Later po, no, binibigay din po natin, or I think i-mention din po dun sa ating close contact discussion, how we approach this, how we give out this information sa ating identified na close contact. Also, if first degree exposure becomes a probable and confirmed case, so dati po, no, first generation or third generation close contact lang siya, at naging confirmed case or probable case po siya, dapat po siyang immediately mag-quarantine. Now, also for the general sorry, I think this should be isolated kasi confirmed case na siya. Yeah. First degree exposure, sorry. So for the general contacts naman po, advise as well to self-monitor and strictly adhere to minimum public health standards. And for the close contact of suspect case is again po self-monitor and also adhere to minimum public health standards, and if exposure nga po becomes probable or confirmed case, immediately quarantine in a facility. Ito pong si close contact. Now, also, if symptoms manifest, immediately do self-isolation. So ito po yung time na kapag ito pong mga tao na to ay nagkaroon ng sintomas, self-isolation na po ang kailangan, hindi lang po basta quarantine, and to contact the BHERTS for assessment and possible referral to a facility isolation area. Also, ito po ang ating decision matrix for the management of close contacts. Again, ito po ay siguro mas extensively madidiscuss later. So, depende po sa kanilang health status. So, for asymptomatics, ito po yung nagde-dictate kung saan po silang isolation and quarantine facilities. Asymptomatic, quarantine facilities. For symptomatic po, either TTMF or hospitals. For the diagnostic test with RT-PCR only if symptoms manifest. Same with symptomatics. With RT-PCR pa rin po. Alright. Now, also another layer na atin pong titingnan lagi is yung ating pong mga travelers, mga incoming travelers to the country. Alright. Now, ito po ang ating current na directive. So for all travelers, particularly inbound travelers po, no, and domestic travelers, they shall undergo the following assessment. So for clinical, screening of symptoms indicative of COVID-19, as well as comorbidities and other risk factors. Second po is the exposure. For screening of possible COVID-19 exposure, such as travel from areas with sustained transmission. Also, all individuals must declare possible exposure to COVID-19 within 14 days prior to entry. Now, also for the returning Filipinos naman po, this is, nagbalik lang. Okay. Now, also guideline naman po for inbound travelers natin. Here, in addition to what was listed earlier, all arriving travelers shall undergo 14-day quarantine upon arrival. The first 10 days po of which shall be observed in a quarantine facilities, with the remainder to be completed under home quarantine in the respective local government units. Mahalaga po yung role ng ating LGU sa aspeto na ito, no? Kasi din po yung LGU handover na nagaganap. Also, RT-PCR po shall be conducted on the 7th day, with day 1 being the day of arrival. Now, if the result is negative, complete the facility-based quarantine period of 10 days. Yun po ang directive din natin. In addition to this, the following country passengers coming from the following areas are not allowed to enter the Philippines until May 31st po. So that's India, Pakistan, Bangladesh, Sri Lanka, United Arab Emirates rather, and Oman. Ngayon, discuss po natin later ano po yung bakit po nagkaroon tayo ng ganitong discussion or directive as well regarding po sa variants na nakita. And also for the interzonal domestic travelers naman po, we have this table as well. So for asymptomatics, ang intervention po natin dito is allow them to travel following LGU quarantine and testing guidelines. Depende po sa LGU yan. And for symptomatic or suspect case, kailangan po nila magpa-RT-PCR and isolate in an appropriate facility depending on symptom severity. So that's either TTMF or hospitals. Now, we go over naman po to the biosurveillance and variants of concern. Something that we often hear, actually, maganda po na queue or na-start na din po nila Asik at saka nila Director Telma yung atin pong discussion on variants of concern and how it affects our current COVID-19 response. So una po, why are we doing this? So the strengthened biosurveillance effort, para po siyang detective work actually. We're identifying the organisms based on their DNA fingerprints. Ang COVID-19 po kasi, much like any other virus, at saka organisms po, they may undergo certain mutations po. Again, these mutations vary. Again, meron po tayong mga variants of concern. Meron din po tayong mga variants na hindi naman po variants of concern. It's just that they showed some kind of mutation. Also, for the whole genome sequencing, this links the disease or outbreak to the source of infection. Makita po natin ito yung graph na binibigay or sinishare sa atin ng UPPGC. By the way, ang atin pong biosurveillance efforts are in partnership po with UP Philippine Genome Center, UP NIH, RITM, atin pong of course LGUs, napakalaki po ng participation nila, ng CHDs natin at RESU. And then kung mababalikan nyo po, no, nung January po, we were able to detect the B.1.7 or the UK variant in some positive samples in the country, both from returning overseas Filipino workers and returning overseas Filipinos and local case. Ito po example po nila. So yung yellow po na yan, isa pong data yan from cases from UK. And then ito pong purple are local case. So makita po natin through whole genome sequencing, na-track po natin kung saan nanggaling yung virus na nakuha ng isang individual na sinesequence natin yung kanilang positive samples. So kaya po niyang matrack kung saan po nagmula or nag-branch out. Ngayon, ano po naman yung relevance? Yung una po is nagko-contact tracing po tayo for whole genome sequencing, lalo na po sa experience natin, I think in CAR, and we were able to identify some. However, ang mas mahalaga din po nating tandaan is that for these variants of concern, pareho pa rin naman po ang management, but what makes them different? At ano po yung implication niya sa ating pag-manage at pag-responde sa COVID-19? So ito po yung mga characteristics ng variants of concern. So according to the Public Health England, ito po yung mga characteristics ng VOC. First is increased transmissibility, meaning katulad po ng B.1.7 or yung variant na una pong nakita sa UK, mas mataas po ayon sa pag-aaral yung possibility or probability na matransmit yung virus kumpara po dun sa original na or iba pong variant ng COVID-19. Also, increased virulence or change in clinical disease presentation. Pwede din po na magkaroon ng escape from immunity derived from natural infection. Ibig pong sabihin nito, posible po na yung isang variant of concern, pagka nagkaroon po kayo nito, pwede pa po ulit kayong ma-reinfect kasi kulang pa po or currently po nag-update pa rin tayo ng information natin on what we know. Pero yung iba pong pag-aaral is nakita na hindi or nahihirapan makabuild ng immunity ang katawan for certain variants of concern. And then lastly po is decreased effectiveness of public health or clinical countermeasures. For example po, napaka-importante bakuna. May iba pong variant na sinasabi na hindi po nakitaan pa ng masyadong reaction to some vaccines na meron. However, ang atin po sanang messaging dito is that ang variants po, kaya po siya nagkakaroon ng mga bagong variant is dahil po natatransmit siya. If we are able to stop the transmission of COVID-19, bibigyan po din natin ng mas konting oportunidad yung virus para mag-mutate. Kasi doon po siya nagkakaroon ng iba't ibang concerns natin pag nag-mutate na po siya at later on ma-find out natin na naging variant of concern na po siya ayon sa pag-aaral. So, bigyan ko lang po kayo ng maiksing summary din kung ano po ba yung mga variants of concern na nakita na sa Pilipinas, and I think narinig nyo na din po ito sa news. So una po dun is yung B.1.7 na una pong na-report sa UK. We also have the B.1.351 na South African variant po siya ng unang nakita. We also have the P.1 na nakita po sa Brazil at yung B.1.617.2 na nakita po mula sa India. So ang suggested po namin na messaging, although mukha pong mahirap siyang banggitin, we try to avoid po associating them directly by saying na ito po UK variant or South African variant kasi po sila po ay doon lang unang na-detect. Hindi po proven na doon po talaga siya nangyari or nagawa. So Also, syempre, ayaw din po natin ma-tag yung ibang countries as such. So, we stick po dun sa pangalan ng lineages. Also, ito po yung summary lang po ng potential impact. Nilagay ko po, highlight ko po dyan yung potential. Bakit po potential? Kasi habang nagko-collect po tayo ng whole genome sequencing or biosurveillance information, mas marami po yung nalalaman natin, nakukonekta po natin siya dun sa epidemiologic data na meron tayo. For example, yung B.1.7, una po yan nakita sa United Kingdom. Sabi po nila around September, nakita na po yan ng mga scientists nila, pero nireport lang po siya as variant of concern ng Disyembre. Bakit po? Kasi for those months, binabantayan po nila ano po ba yung nagiging pagkakaiba doon sa mga areas na or mga tao po na nagkaroon ng ganitong variant. So nakita po nila no, yung isang area na maraming B.1.7, mabilis po yung pagtaas ng kaso. So kanila pong naisip or na theorize na meron pong increased transmissibility associated dun sa variant na ito given certain mutations. Also, immunity. So inalagay po dito ang asterisk. Further studies needed to determine po the effect of variant in the immunity. So pinag-aaralan. And then sa severity po, may ibang pag-aaral na nakakita na mas matagal po yung ginugugol ng tao na may B.1.7 sa ospital kesa dun sa wala. Although ito po ay limited po, very limited po ang ating data. Yung information po na mostly ng studies ay galing pa po sa ibang bansa. And we hope na sa Pilipinas, as we gather more biosurveillance information, we can replicate those studies as well. So pareho po no, sa B.1.351, meron po siyang potential impact on transmissibility, immunity, and severity, pareho ng P.1. And then ito pong last is yung B.1.617.2 na naririnig natin na una pong nakita sa India. So increased transmissibility and immunity ang kanyang potential impact. So yun po, just an overview of how we understand yung variant of concern. I'll reiterate po, no, pareho po ang management dyan. Pareho po, wala pong nagbago sa paraan ng pagtatransmit at ang protection pa rin po ay yung pagsunod sa minimum public health standards. It's just that as public health worker, as frontliner, alam natin yung implication or importance ng pag-contact trace at pag-stop po ng transmission given na yung kalaban po natin ngayon ng mga variants ay mas nakakahawa or mas madali pong matransmit rather, mas transmissible po siya. And yun nga po, may maaring epekto po siya sa ating vaccination efforts. Now, just to give some overview ng ating result ng biosurveillance runs. So currently po, we have sequenced 7,250. Minsan po ang tanong sa LGU, bakit ang unti lang? Nakita po natin yung kaso natin kanina is umabot po ng mahigit 1 million na. Unang-una po yung sequencing po natin, we do only among positive samples na nag-meet po sa criteria. So ito po ay clinical criteria, sapat po ba yung amount na meron para po mag-sequence sila. Isa pa pong reason, very limited po ang resources. Mahal po ang mag-sequencing. Kahit po ang ibang bansa, UK, hindi po nila sinesequence lahat ng positive test po nila. Mahirap po siya at ngayon nga po may shortage pa ng mga kits kasi lahat po or marami po din developed countries na nagsisequence din ng kanilang mga positive samples. And also, gusto lang po natin malaman yung presence mismo or yung kanila pong dami, at least in terms of proportion sa ating pong bansa, not necessarily to check each individual. Now, sa latest run po natin, meron po sa kanila na nakuhanan ng lineage. Ibig sabihin po, nagkaroon po ng assignment ng pangalan ng variant, 5,991. Yung iba po kasi ay hindi na nagawan or hindi po nakabuo ng lineage. Kaya mahalaga po na yung atin pong samples is sumusunod dun sa criteria. Also, dun sa latest run po natin, we have 37 samples. So ito po yung mga special run. Maliit po talaga kasi din to save time and also po depende po sa ating objective. May mga na-detect po tayong variants of concern dito. And overall po, among all that we sequenced, 601 po dito are from ROFs and that's 8.3% of the total sample sequence so far mula po nung nag-umpisa tayo. Ngayon, ano po ang resulta? In the country, 35% of the 5,991 samples na may lineage ang may B.1.7 at B.1.351 variant. And 12 pong regions ang with local na may local case positive po dun sa B.1.7. Ito po yung variant na una pong nakita sa UK. And then may 15 regions naman po, although majority po ng numbers natin ay nasa NCR, na nakitaan ng B.1.351. Now sa NCR, makita po natin siya yung isa sa may pinakamatataas na numero, no? All NCR cities are affected with the variant of concern. And among the total number of samples with lineages, 15% po dito are cases coming in from international travel. Given din naman po no, na madami din po tayong sinasamples among ROFs. And expected po ito actually. Now, in terms of spread, yun po yung itong isang bagay na interesting at paano po papasok dito ang ating contact tracing. Nung nag-start po tayo ng February, ito po ay spread of the variants of concern, so B.1.7 and B.1.351. Paano siya nag-spread sa ating pong mga regions across time. Nung February po, nakita lang natin siya madami sa NCR, and then also in the north, papataas, meron pa tayo sa CAR and some other areas in the south. Nung March po, nakita po natin no, ang bilis na nag-spread din siya sa iba't ibang regions ng bansa. And currently, ito na nga po yung itsura natin as of April po ito though. So, ang ano po natin is with potential increased transmissibility, ang roles po natin as contact tracer and also in detecting, yung una po muna, syempre, we need to detect those cases before makapag-contact trace tayo. Napakahalaga kasi we need to contain these cases para po iwasan din natin ang further mutation ng ating pong virus. Now, updates ng atin pong ang samples na meron tayo. Sorry, i-adjust natin ng konti. So, sa lahat po ng nasample nating sequence, the B.1.351, yung South African lineage, is the most common lineage nationally. And once detected in a region, becomes the more common lineage. Pero ito po again, among those samples sequenced. And also, the B.1.7 comprises of 16.1% among all sample sequenced. Alam niyo po, last mga first months, ang una pong mga variant na nakikita ko lagi pag nagre-report ako is ito pong B.1.63. It's not a variant of concern, pero ngayon po, pumangalawa na lang po siya dun sa B.1.351. Also, we are seeing po yung, we saw P.1, ito pong Brazilian lineage na a variant of concern sa dalawa din pong ROF. And sa latest run po natin, ito po, yung Indian lineage with several spike mutation. Nakita po siya sa 12 sample nag-positive. Ito po ay among ROFs din. Okay, so what do we do with this information? Madami po siyang information, yung iba po alarma, yung iba po nakaka-curious din po, no? Pero ano po yung gagawin natin dito sa mga information na present? Ito po yung some of the recommendations that we have. So, contact tracing efficiency depends on immediate case detection. Bago po tayo makapag-contact trace, kailangan ma-identify muna po natin ang kaso. Right? So, we have to focus as well on measures to shorten the number of days from onset of symptoms to isolation. So, once na-detect po natin and isolate, kaya po nating magpa-test na at mag-contact trace among these individuals. Also, once na-detect po natin sila, ensure that isolation and contact tracing is initiated already once a symptomatic or suspect case is detected. Alam po natin lahat, no? Time is of the essence. Ang target po nga natin for contact tracing is within 24 hours, although alam natin na marami po yung kasamang challenges talaga given our resources and sa dami po ng kaso ngayon. Pero again, yun po yung mahalaga talaga na mahanap at ma-detect po sila. Also, lastly, is strict enforcement of the 14-day quarantine among incoming international travelers to prevent transmission of variants of concerns in the community. Makita po nyo or mabalikan po nyo yung akin pong pinakitang table kanina ng mapa ng Pilipinas na 3. Nagsispread po talaga siya ng mas mabilis kaysa sa usual na variants na meron na non-variant of concern. So napakalaga po na matapos po yung 14-day quarantine. Kung babalikan din po natin yung patient journey, hindi po ibig sabihin na na-test po siya na negative, ipapakawalan na po siya or matatapos na po yung quarantine. Mahalaga po na yung 14 days talaga, reiterate, kailangan pong tapusin ng atin pong mga close contacts and confirmed or suspect case. So with that po, that ends my presentation. I hope meron po kayong mga napulot na information that you will take pagbaba niyo po sa ground or when you do contact tracing. Maraming salamat